When?
My name is LaWanda Jefferson, and I'd like to thank everyone for coming out for my presentation on patient falls in the elderly. Today is November the 17th, 2012, and today we're going to talk about falls in the elderly patients. You have your handouts on the elderly, and we're talking about the elderly patient or the older adults, and they are the biggest proportion of patients in the hospital today, with patients living longer. Patients 65 and up has a higher number of falls because of the medication they are taking and the condition, the chronic conditions. So today we're going to talk about some safety guidelines that we can use to keep patients from falling, and some things that we can do as nurses to help patients stay safe while they're in the hospital. First, we're going to talk about, and this is on your handouts, first we're going to talk about the condition that causes fall. The patient might come in with one condition and be disoriented. A patient might be on medication, and it's a thing, and it's the Beers list. Beers list is a list of medications that older patients are on that causes adverse reactions. So we have to make sure that we monitor these patients closely. Patient with vision impaired, with hearing problems, with mental status issues. We're going to monitor those patients closely. And some environmental things that we can do in the hospital is we make sure that the bed is in the lowest position, make sure that the size rails are up if the patient is confused. Make sure the call bell is in reach. Make sure all personal items are in reach so that the patient don't have to climb out of bed to get these items. We as nurses have to monitor patients more closely, maybe every hour. If you can't monitor the patient, maybe the CNA can monitor patients more closely. And we talked about the call bell. Make sure the patient has the call bell. Make sure that the patient stands. When the patient stands, we're going to make sure that he stands slowly, and so he won't get dizzy and fall. And the very important thing we need to do is during the initial assessment when the patient comes in, ask the patient, have you fallen recently? What type of medicine do you have? So we have to do a thorough assessment of the patient. Some things that also causes a patient to fall is Down syndrome. That's when the patient is disoriented, and it generally happens at night. When the patient is confused, he wakes up and he don't know where he is, and they'll fall at night. Urinary incontinence is another thing when a patient can't control his bladder and maybe feels ashamed or she feels ashamed. So they kind of try to get up and handle things themselves. But a new thing that the facility I work with are using, and everybody needs to do this, is the yellow falling star armband. And it's on every patient that has a potential for falling. And this alarms or signals all departments, radiology, x-ray, CAT scan, that the patient has a potential for falling. So if anybody have any questions, okay. That concludes my presentation on falling. Thank you.